There are very few aesthetic clinics today without monopolar RF. Today, I'd like to talk about cannula-based monopolar RF. This system delivers monopolar RF energy through the tip of the cannula. I'll explain its advantages and various clinical applications. I've been working as a consultant and KOL for CHUNGWOO for about a year. Thanks to APOLEX Tite, I've had the opportunity to present at international conferences including IMCAS Paris and Jakarta, Indonesia. What first interested me in cannula-based monopolar RF was not simply fat reduction or contouring. Our clinic performs many collagen booster procedures such as radiesse. In rare cases, nodules can occur after treatment. One effective non-surgical option for treating these nodules was monopolar RF. That was when I first encountered APOLEX Tite. After using it myself, I found it far more interesting and versatile than expected. To be candid, I initially wanted to keep this device to myself. That's how satisfied I was with the results. There are already many lifting devices on the market. But in real clinical practice, simple lifting alone is often not enough, especially when fat volume increases and sags in the mid and lower face. In these cases, reducing volume while tightening the skin becomes very important. That's why I find APOLEX Tite especially attractive. Aging is not caused by skin laxity alone. As we age, facial fat distribution changes over time. Some fat compartments decrease, while others sag downward. For example, the buccal fat pad decreases over time. But fat around the nasolabial fold, marionette area, and double chin often accumulates and sags. That's why reducing unnecessary fat volume is just as important as lifting the skin. Monopolar RF generates heat through tissue resistance, also known as impedance. Tissues with lower impedance and higher conductivity receive more energy. Tissues with higher water content exhibit significantly greater conductivity. That's why tumescent solution is extremely important during APOLEX Tite procedures. Tumescent solution is not just for anesthesia. It also increases tissue hydration for more efficient RF energy delivery. It also helps create space, reduce pain, and minimize bleeding. Conventional external monopolar RF delivers energy through the skin surface. As a result, much of the energy is absorbed by the septa rather than the fat layer itself. APOLEX Tite directly inserts the cannula into the fat layer. This allows stronger and more direct energy delivery to fat tissue. As a result, both fat reduction and skin tightening can be achieved simultaneously. One of the biggest advantages of APOLEX Tite is safety. The device includes real-time temperature sensors and impedance monitoring. If the temperature rises above the preset level or tissue conditions change, the output automatically stops. Energy is delivered only from the tip of the cannula, not the entire shaft. This minimizes the risk of skin burns and allows more selective targeting of the fat layer. In actual clinical use, the pain level is lower than expected. Procedure time is also relatively short. Compared to conventional liposuction, bleeding is reduced. Fat removal becomes smoother, while tightening effects can also be expected. It also helps reduce unevenness and skin laxity after liposuction. Immediate collagen contraction can be seen after treatment. Collagen remodeling continues for several months afterward. This leads to gradual improvement over time. At temperatures ranging from 40 to 50 degrees Celsius, direct thermal effects on adipocytes can also be achieved. This contributes to additional volume reduction. Once removed, fat cells do not easily return. With proper treatment, long-lasting results can be expected. Many patients are highly satisfied even after a single session. Additional treatments can be performed several months later if needed. APOLEX Tite can be used not only for the face but also for body treatments. It is especially effective for double chin reduction, nasolabial folds, marionette lines, and lower face contouring. Personally, I believe this device has extremely high clinical versatility. It also works very well in combination with other lifting devices. That concludes my presentation today. Thank you.